Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. In a previous video, I talked about what physical therapy should not look like if you have some type of back, butt, or sciatica problem. You're trying to give yourself the best chance of healing naturally. So, okay, Charlie, this is what it shouldn't look like. These are the indicators that the PT is lost and confused. Well, what does it look like to work with someone who can give me the best chance of solving the problem? What does good physical therapy treatment look like? So in this video, we're gonna outline what that is and what that should look like based off of my experience, in my opinion, of course. But that being said, in case you're wondering, well, who is this guy to say what good physical therapy should look like? So again, my name is Dr. Charlie Johnson. I'm a physical therapist. I have an orthopedic board specialty. I am residency trained, taught at the University of Southern California, and only help people with back, butt, or sciatica problems. So this experience puts me in the top 0.5% of PTs, knowledge and education-wise, in the US for this specific area. So just highly specialized, by the way. It doesn't mean I know everything, just means that I've treated over 10,000 people with these problems, lots of cases after working with hip and spine surgeons for quite some time, just a lot of reps under the bar, and so I want to share that experience with you. All right, so let's dive into it. Oh, and real quick, if you'd like to download my brain and understand the algorithm that I use to determine the most likely source of your back, butt, or sciatica problem, be sure to download my Better Than an MRI DIY diagnostic guide above for free. All right, so here are the 6 telltale signs that your PT is probably confused and not really sure about what to do, which means that you're going to be confused and you're not going to have the best chance of solving your problem. Number 1, they're unscientific and they fail to follow a specific test, treat, retest model. They're guessing, not testing, giving you a sheet of exercises. Number 2, they lack a process. They change up the order of operations every single time. Number 3, there's no tracking system. You can't manage what you don't measure. Because they're not tracking anything, they fail to change when things aren't working because they don't know what to change or even if they need to change treatment. They ignore the power of optimizing the healing environment and healing by subtraction. Everyone's obsessed with doing more to get better faster, but it's actually what you don't do and what you optimize for mentally and physically. Habits, routines, beliefs, fears, worries, concerns, understandings, misunderstandings around what pain is and what you're experiencing. It keeps you from getting better. Make sure people are educating you on that. And then they do lots of stuff that just feels yucky. It hurts so good, but that means it still hurts. And as a result, you feel yucky. So you put yucky ingredients into the pot, you get yucky ingredients, or sorry, a yucky result out, all right? So what does treatment look like optimally if you were to see a physical therapist for this issue? Well, let's just reverse all these. So it is scientific. What do I mean by scientific treatment? The scientific method is essentially we have a hypothesis of what could be happening. We set up an experiment. We test that experiment or that question, and then we get some results. And we use those results to determine, all right, were we accurate in our thought process? Do we need to change what we're thinking? Or are we on the right track? And so taking a scientific process when it comes to working with someone when you're trying to get out of pain looks like this. You test, you find a yucky motion, and we teach everyone who works with us how to do this. You find a motion that does not work, a yucky motion. Then you treat one motion. People will just need one motion to resolve most of their aches and pains within the context of a process, which I'll talk about in a minute. So we test and find something that does not work well. When I bend backwards, ouch. When I do a figure 4, try to put on my socks, ouch. When I try to straighten my leg up, ouch, that hurts. A yucky motion. We objectify it. All right? We put some numbers to how bad that hurts. Then we treat. We do something that feels good, feels safe, not yucky, right? And then we immediately, in the moment, retest to determine if that input or that treatment or that exercise, that one exercise, by the way, is valuable, is a waste of time, doesn't make you any better, so it keeps you the same, or makes you worse, in which case we want to avoid it. And so rather than giving you a sheet of many different things to do, we test out individually different variables and different hypotheses and questions to say, all right, I wonder if this person could use this motion for X, Y, and Z reason. Well, that's a really good question. So let's find something that feels yucky, that you can't do. Then let's go ahead and let's do that thing, test it, and then let's retest that thing which was yucky to see if it made us same, better, worse, all right? So we follow this test, treat, retest, and then we follow some rules. Either something makes you better, it makes you same, or it makes you worse. Model, and again, we want to see an immediate change. Don't fall for the, hey, well, it should take you a week, it should take you a month, or well, we're just going to stick with this a little bit longer and see if the treatment works. If a treatment does not work immediately in the moment when it comes to using movement as medicine and talking about structural injuries to the back, butt, or leg, herniated disc, piriformis, SI joint, sciatic nerve, you should see an immediate change now. If you don't, then you have no evidence to believe that that thing which didn't work will somehow in some way work in the future. 0% change in the moment times any amount of treatments you want to continue to go to because they told you, hey, it's just going to take time. Whatever amount of time you want to allow that to play out for, 0% change is going to equal 0% better. All right? So if better, good, great. We only have the one motion. We don't need to go searching for something else. If same, we're not going to waste our time. And if worse, again, we can avoid that. We can continue to plug in, let's just say A, B, C, D. Plug in A to this process. Nope, doesn't work. Plug in B to this process. Nope, doesn't work. C, D, so on and so forth until we find exactly the right recipe or the right motion input for you. So if you're doing more than one exercise, you're doing many different exercises or treatment inputs, then ask the person you're working with how they're going to prove or determine if the things that they're doing are working or not working and how they're not going to interact with one another, right? So here's the other thing is that you could be doing exercise A and maybe exercise A, independent of all the others, makes you feel better, right? In which case, we don't need to do anything else, in my experience. But then they pair exercise B and C and D with it. And, well, B doesn't do anything, makes you the same, and C and D, when tested out individually, actually make you worse. Well, you can see that the net effect of all those things combined is that it either makes no change or makes you worse. In which case you say, exercise A didn't work, Charlie, I already tried that. No, you didn't try that. You tried exercise A, B, C, and D. We wanted to isolate what A did, and B did, and C and D did. All right, and so if you're not isolating these variables, it's possible that you're having sort of this conflicting interaction between the two, whereby one is sort of counteracting the side effect of the other. And the net result is you say, these exercises don't work. All right, so we want to be scientific, follow a test, treat, retest, same, better, worse, follow the logic type of methodology applied to healing, applied to using movement as medicine. Remember, if you're trying to use movement to solve your problem, and if you can consider that movement is a potential medicine, meaning it could help you out, then the goal is never to take more medicine than needed. It's always to take as much as needed, as little as necessary. So we want to find one pill for you to take. Right? The second thing that you should be considering or looking for when it comes to finding someone who's going to give you the best chance of solving this problem is that not that they lack a process, but that they have a process. All right, so the opposite of having no process is having a process, following a system. I said in the last video, and you can always check it out if you want, but imagine if every time a surgeon went to do surgery, they changed up the order of operations. They decided one day that they were going to wash their hands second after the operation instead of washing their hands before. You can see that the outcome would not probably be all that great, and you'd have infections and things like that. So you can't just decide to change up the process. And I guess you can, but the results will be inconsistent. You won't be able to identify exactly what about that process is not working or fudging the results. All right, so we want to have a process. And so for us, there is a 4-step pain relief process. Step 1, everybody who has back, butt, sciatica problems, I don't care if you've had it for 2 years or you've had it for 10 years, everybody starts by optimizing the healing environment. And the analogy is very straightforward. You can't out-exercise a bad diet. You can't outrun the fork, meaning you can do exercise and different hands-on treatments, but those things will render themselves useless or less effective in the presence of an environment which is keeping you from getting better. Right? So in the weight loss example, you can run on the treadmill all you want, but if you eat donuts for breakfast, lunch, and dinner, it's not going to matter. You're going to say, treadmill doesn't work, exercise doesn't work. It does, but you kept it from working because you didn't change your diet, you didn't change your environment. Same thing goes for healing these issues. Pain is a very sort of complicated, many moving parts type of experience. And so we want to keep this simple and we want to keep it very methodical. Step 1, you optimize the healing environment mentally, beliefs, fears, worries, concerns about what's going on. We educate you on what pain is, what pain isn't, what's really driving your symptoms. Then physically, what about the habits, routines, things you don't know are keeping you from getting better? This is very important because then and only then, once we have this cleaned up and we know you're not picking the scab and keeping yourself from getting better, holding yourself back from healing, then can we start to go to the next steps. Step 2, you've got to self-assess, and you can't manage what you don't measure. Start to identify, and I'll flash something up on the screen here in a second. Start to identify some key metrics or numbers that you can track week to week, such that when you're in pain, you tend to go insane. And instead of going off of how you're feeling that day or what you think is happening to your progress or lack thereof, you go based off of the numbers and you make decisions based off of data, not emotion. You stay objective throughout the process, all right? So we have people track the top 3 yucky motions. They go through a scan of essentially 12, 13 different motions or movements. Within that, we have them take the top 3 yucky motions, and then beneath that, we have people identify their top 3 pain triggers. Now, we don't really care about the motions and the fact that they're painful per se in and of themselves. The reason why we care is because life is motion, meaning if certain motions are yucky, let's just say you have a yucky leg raise, well, your ability to drive a car is going to be significantly impacted. If it's your right leg and you have to straighten your right leg out in the form of a leg raise, an isolated motion, well, that thing is going to show up in your life as your inability to drive. And so while you care about the function, the pain triggers, and we can track those things, we know that if we can improve that movement experience and reduce your yucky motions, either using movement, so physical inputs, or psychological, mental inputs and strategies, then your ability to live life automatically occurs. So we put the trust in the process, we focus on the pain relief process, and we allow pain relief to naturally follow. We don't focus on pain relief hoping that it just happens randomly because we have no process. Step 1, optimize things mentally and physically. You can't out-exercise the bad diet. Step 2, self-assessment. You can't manage what you don't measure. Get objective and track top 3 yucky emotions, top 3 pain triggers, and you can track this once a week so that you can make decisions at the end of the week of, hey, if I'm headed in the right direction, my trend is going where I want, then I'm not going to change that. If you're stuck and things are same overall, then we need to change the inputs because we don't want to keep doing something that's making no difference. And if you're worse, we clearly have to change what we're doing. So not only does it tell us what we're trying to improve, but it tells us if we need to change what we're doing. And so then step 2, right? Self-assess, start to measure things. Step 3, now and only now. We didn't even talk about exercise yet. Once we've optimized things, we've got a baseline, now we can start to test, treat, retest, and be scientific in our process and our logic to find the top 1 motion that you need to do. We start by identifying what we call your pain pattern based off your location of symptoms, your specific story, and how you respond to a movement exam, the motions that feel good, the motions that don't feel good. We're able to identify a pattern. I found that people fall into 1 of 4 pain patterns. I may need to create a video on that for you. But once we do that, it gets us in the ballpark of here's where we're going to begin testing motions. You have to know what to test. It's one thing to say, okay, I'm just going to test 1 motion at a time, but what motions do I test? I have found, as somebody who's treated thousands of people with these problems and really gone to sort of the extent of studying almost every different approach as it relates to resolving these issues, there are 118 possible different movement options. Big picture. You can move the body forward, backwards, right, left, and twist it right and left, northeast, south, and west in rotation. And then there are different body positions. And so if you take those body positions and you grid them against the way the body can move, we have roughly 118 different options. All right, so, well, now where do I start testing, Charlie? We help you figure this out right away by identifying what we call a pain pattern for folks who work with us inside our Glute Relief Accelerator program, all right? So we can start testing, treating, retesting to have you walk away with the 1 thing you need to do, not a sheet of exercises, all right? And then finally, then we talk about getting back to life. A lot of people just take the approach, well, I'll just rest and avoid, whatever is painful, and then once the symptoms go away, I'll just get back to doing stuff. But the problem is that regardless of the cause of your symptoms, the longer you avoid something, the more you reinforce that that which you're avoiding is dangerous. And so you actually start to train your brain to be afraid of and to be fearful of and to be avoidant of these activities that you love and you want to get back to. And so avoidance is never the answer. At some point, once we see, this goes back to the measurement piece and tracking piece of the process, step 2, is that once we see those yucky motion scores go down by about 50%, then we know we're ready to start doing what I call crossing the chasm. When people start in the process with us, their pain is high. Maybe you're watching this right now and symptoms are really high. Your function is pretty low. But as pain goes down, you naturally start to want to do more. And usually when those scores are about 50% reduced, you'll start to get more engaged with stuff, and I'll start to give you the green light to start to do activities in a very progressive fashion. So we coach you back to full speed and then talk about prevention on the back end, all right? So there's a process, simply put, all right? So step 1, optimize the healing environment, mentally and physically. You cannot exercise the bad diet. Step 2, you can't manage what you don't measure. Self-assess, you're the one who experiences pain. That means you are in the best position potentially to solve this if you have the right coach, the right mentor, and the right tools, knowledge, and resources, which we give you all of them. And so you do that. Step 3, movement as medicine. And step 4, getting back to life and talking about prevention. There is a very clear process. We don't switch that up and decide, well, hey, the bike is occupied right now, so instead of starting with the bike, we're going to start here, and then you're going to get hands-on, and then you're going to do exercise, and well, the next day, now you're going to see someone else, and you're going to start with exercise, and then you're going to go to the bike, and none of that. How could you possibly solve a problem if you change up how you solve the problem every single time? You would never develop the clinical pattern recognition to figure out what the problem is and how to solve it as quickly as possible. And if you're watching this, I'm guessing you want to solve this problem as quickly as possible and as efficiently as possible and not waste any more time, energy, and money. And that's what we're all about doing, all right? So we have a process. The third thing, and I already talked about this, is that most PTs and providers have no tracking system. Have they shown you a way such that you can see, feel, and understand what's happening in your body and really objectify the pain experience? Are they showing you certain numbers every single week and or after they're testing things to prove to you that what they're doing is working, that you need to change things, and what do you need to change? If they're not revealing that to you, then ask them, how are you tracking my progress week to week to know if what we're doing is working, if we're staying the same, or if we're getting worse? And how can you teach me, meaning you, the person in pain, ultimately should be in control of your rehabilitation or the solution to this problem, because unknowingly, you created it, all right, mentally or physically. And so we want to give you the tools and put you in the driver's seat. So how can we teach you a tracking system? By the way, everybody who works with me gets access to a private healing log where they track progress. It's all self-reported. You're the one actually guiding the journey, if you will, back to full health. And so what is the tracking system that they're using to identify immediately with every single input or treatment or motion that they're testing, if it's helpful or not? And then how do they know if what they're doing is really working versus a simple, how are things feeling today? And we know that could be influenced by many things, whether or not you had a good day at work, whether or not you slept well, whether or not it's sunny or it's rainy or it's warm or it's cold. So many things can sort of make us feel warm and fluffy or not. But the numbers do not lie. We make decisions based off of data, not the emotion. All right. So we have a tracking system. Failure to change. Again, you cannot change anything if you do not identify that you need to change something, and if you do not identify what you need to change. And so the fact that we have a tracking system, when we have a process and we're scientific, tells us if something's working, not working, or a waste of time right away. It tells us exactly if things are moving in the right direction or not, and what things aren't moving in the right direction if we're a little bit stuck somewhere, and what we need to focus on. But again, if you have no sort of goal, if you have no tracking device, a GPS, and you have no destination because there has been none that have been set, then you will be lost, all right? So we do not fail to change. If we do not see an immediate improvement in somebody's ability to move or function after testing a motion, we're talking within 30 seconds, we're not doing that motion, all right? And if week to week, say 4 to 7 days after starting a specific treatment, it's got to work immediately in the moment, but then 4 to 7 days later, if the trend is not better, we are not sticking with that. And so we're constantly changing and iterating based off the data, all right? So we do change, and we change not based off the emotion, but off the data. We place a high or a heavy emphasis on healing by subtraction. We don't ignore the power of knowledge. Knowledge is potential power, but you have to know the right knowledge. You have to have the right understanding of things and the right resources. And so the first thing we do, notice how I didn't say we do exercise as step one. That's step three. Step one is to optimize the healing environment. Everybody's so focused on the exercise part and the treatment side of things, right? What can I do? Dr. Charlie, I'll get a comment on this video. What are the exercises to do for back, butt, or piriformis / sciatica pain? And while that's a conversation we can have, and I've had in other videos, that would be silly of me to have the conversation without first helping you identify what about your healing environment is keeping you from healing. What things do we need to potentially subtract? And the tricky thing is that probably what you're doing and what you've been told to do, the figure 4 stretches, the nerve glides, the prone press-ups, the foam rolling, sitting on a tennis ball, those things that you've been told to do are probably keeping you from healing. We'll talk about that here in just like, 20 seconds. But sometimes what you've been led to believe you should do is keeping you from getting better, and it's all based off your belief system or what you've been told to do. And so we want to kind of calm muddy waters, get a clean baseline, and actually do less to get more clarity. Less equals more clarity, more equals more confused and more chaotic in your thought process and in your understanding of actually what's happening, all right? So we educate people heavily on how to determine what in their day-to-day life is keeping them from getting better mentally or physically. We teach you the step-by-step tests or experiments that you need to run to improve sleeping, sitting, getting up, rolling over in bed, standing, walking, driving, bending, gardening, doing dishes. All of these things, most of the time, this stuff is stuff you do not know, and that's okay because this is not what you do, but this is why you reach out to a professional, right? You need to actually solve the root of the problem. This is why pills and shots and surgery, they might work temporarily, but did they teach you why the problem started to begin with? If not, and you go back to doing the same things you've always done in the way you've always done them, well then if nothing changes, and your problem will come back and it'll bite you in the butt on the back end, literally, all right? And finally, remember I alluded to the fact that sometimes what you've been led to believe you should do by a PT or another provider, or maybe by another video on YouTube, because that's what they say you should do. You should strengthen your glutes, you should stretch out your piriformis, you should release your hip flexors, you should remove the trigger points from your butt by foam rolling and sitting on tennis balls and all this other stuff. Cool. Not scientific, no process, no tracking system, ignoring healing by subtraction. But a lot of times these things hurt so good. So remember, one of the signs that PT is probably not going to be very valuable for you and that they might be a little bit lost and confused and not sure what to do is that they're doing things to you with their hands, manual treatment, or with certain devices that hurt so good. So think deep tissue massage, poking their finger into your butt cheek, doing active release, myofascial, using massage guns, all these things that are hands-on treatments, stretching in certain ways that you should be stretching, but it hurts, and you're saying, this is weird. It hurts when I do this, and I guess maybe it has to hurt before it gets better, and no pain, no gain. And the PT told me that I might be more sore before I get better. I don't buy that, and I would suggest that you don't either, all right? So if they're doing things to you with their hands or with other devices that are hurting in the moment, then you're probably going to hurt more when you leave that clinic. Or if they're prescribing exercises, and then you're sort of self-inflicting when you go home because they said I needed to push the jelly back in the donuts. They told me to do these press-ups, 10 reps every 2 hours, but every time I do it, I get a pain in my back, and now symptoms are going down my leg. But beliefs inform actions, which inform results. This is what they told me to do, Charlie, so I kept doing it. Stop. If they're telling you to do exercises which feel yucky, then you will feel yucky on the other end in most cases. When I say most cases, you'll have about 5% of people who will respond to doing yucky inputs, but for the vast majority of you, yucky inputs, hands-on treatment, yucky exercises, yucky outputs. So how do we flip this on its head? If we understand that the pain experience is more than just about the body, and we understand that the body is the instrument of the mind, and so pain is an experience of the mind and the body designed to protect you from some perceived or actual threat or danger that you're experiencing currently, then we need to appreciate both the brain and the body in the way that we think about solving this problem. All right, maybe you've just been thinking about trying to stretch out your tight piriformis, but it's connected to a brain and a nervous system which allows you to feel a bunch of stuff, right? And so sometimes the brain can make a mistake, and so we need to appreciate that. So what we want to do is, instead of doing yucky inputs, why not do things that feel safe? Why not use yummy motions? Why not use yummy treatments that allow you to move in ways that feel good, which allow you to start to break the link between movement and PT and treatment and pain? Many people watching this right now will say, you know what? I tried PT and PT stinks. PT made me worse. And so that becomes sort of a trained association between movement and pain. When I bend over to pick things up, I hurt. When I sit and drive, I hurt. When I lift, I hurt. When I walk, when I run, I hurt. And you can see soon enough you've trained yourself to experience pain with those activities. And so if we do certain motions that don't hurt, are safe to the body, well then that teaches our brain that movement doesn't have to equal pain. Pretty cool. And then the more we move and we feel good about moving, the more our confidence goes up, the less our fear and our worry and our concern and our anxiety about what's happening goes down. The less fearful we are, the more we move. The more we move, the better we feel. The better we feel, the less fearful we are. And you can see that we allow ourselves to take this negative feedback loop of, when I move, it hurts. As I hurt, I become more fearful and worried. The less I move, the more fearful I am, etc. We take that and we make it a positive. The more you move, the better you feel. The better you feel, the more you move. So I know I just spit through that really fast, but when you're in pain, it's easy to get stuck in this loop. And this loop is more than just a physical problem. It becomes a psychological problem as well, and they're sort of pretty intimately connected, in case you haven't figured that out, right? The brain is connected to the body, and so trying to segregate them in treatment, thinking that if you do these hurt so good stretches, just to loosen this thing up, all your problems will go away. Every time you do that, you strengthen the association within the brain that movement is bad and treatment is bad. And so the chance, if you're doing yucky inputs, that you're going to feel good on the other side, not very good, not very high. And so we teach people to find not a million different things, but the top one motion that feels safe. Within the process of identifying safe ways to modify the environment temporarily to optimize the healing mentally and physically. We're all about restoring safety to a very sensitive and high alert system. And so you can use movement as an entry point to a sensitive nervous system to teach yourself that you're safe when you move. And obviously the safer you are when you move, because you're doing yummy, safe, feel-good motions, you start to experience more relief and you start to feel more confident in your ability to get back to life. And before you know it, things just snowball and you accelerate your healing rapidly. All right, so hopefully that was helpful, and this gives you an insight as to what PT ideally should look like. And again, this is just based off my experience, so I recognize that as evidence changes and as I continue to make the process and my decision-making better and better, it may change. But after doing this a lot, I'm pretty dead set on this process for now. We follow a scientific process, test, treat, retest, to identify the one thing that's going to help you immediately in the moment. We follow a process, step 1, 2, 3, 4. We have a 4-step pain relief process that I talked about earlier. We don't just decide, well, hey, for this person, we're going to do step 3 first, and then we're going to forget about the others, right? We have a tracking system so that we know if we need to change and how we need to change. We focus on educating you so that you are empowered, that you are in the driver's seat, that you are the one in control of your pain, because it is your pain experience. And I believe there's nobody better to solve it than you. And finally, we teach you how to restore safety using the power of the mind and movement as medicine. If this has been helpful to you in any way, and it sort of helps you see the way that we might approach this differently, and you're interested in getting some help to solve this problem naturally, we work with people all around the world dealing with back, butt, sciatica problems. Again, it's all I do, exclusive specialty, really passionate, as you can tell. Click the link below to apply to work with us. Click the apply link below, set up a time to chat, and then follow instructions to submit a case review. I would review your case personally. If I don't feel I can help, I'll just give you a call. There is no cost to this, as I don't feel it's right to charge people before reviewing a case and making sure we're confident that we can help you out. So go ahead, click the apply link below and follow instructions to submit a case review, and I'll check it out. Thanks so much for watching. Let me know your thoughts in the comments. Does this resonate with you? Have you been to PT, which is unscientific, sheet of exercises, which lacks a process? You start one day with heat, you go the next day you start with exercise. One day you see this person, next day you see that person, right? There's no tracking system. They're not really changing things when you're not improving. They didn't really educate you on how to sleep, how to bend, how to lift, how to twist, how to do any of those triggers which aggravate your problem. And they're doing things which hurt so good, which means they still hurt and you're not getting better. Let me know if this resonates with you. Hopefully you found this useful. Click the apply link below if you're looking for a different approach. Thanks.